Hello and good afternoon, everyone. We're giving folks just a minute to get into the webinar. We've got a large group today and we're delighted about that. Welcome this afternoon to today's webinar. I'm Lori Smetanka. I'm the Executive Director at the Consumer Voice, and we're delighted to have you with us today. Our webinar today is resources for supporting nursing facility residents with mental and/or behavioral health needs. And this is an issue that we're really thrilled to be able to bring to you today and share not only some information and resources, but have our special guests that are with us today from the Center of Excellence for Behavioral Health in Nursing Facilities. We know that this is an area that many have been challenged with, both in terms of providing care for residents who have mental health or behavioral health needs, addictions, a variety of needs that relate to mental or behavioral health, and also for people who are advocating for those residents. So we're thrilled to be with you today. So next slide, Libby, if you can turn to the next slide, we'll do a little bit of housekeeping. As you heard at the beginning, the webinar is being recorded. As usual, if you could please put any questions that you have for the speakers in the Q&A feature, and we will take questions from there once the presentation have ended. You can use the chat feature to submit comments or to respond to questions or to chat among yourselves. There will be an evaluation that'll pop up at the end of the webinar, so please do fill that out when the webinar is over. And the resources that we'll be talking about today will be linked in the chat box and also will be posted to the Consumer Voice website at theconsumervoice.org. And we'll reassert that a couple times throughout the webinar. We're really thrilled today to have two excellent presenters with us from the Center of Excellence for Behavioral Health in Nursing Facilities. Linda Klug is the Senior Executive Director for Quality and Strategic Alliances, and we have Jacob Berlowitz, who's a Program Manager at the Center of Excellence. And without further ado, I'm going to just turn it over to them so we can hear their presentations, and we'll be able to ask questions at the end. So Linda and Jacob, welcome. So glad to have you with us today.
Thank you, Lori. Hi, everyone. Good morning and good afternoon. And today, what we'll be talking about, we'll be splitting our presentation into two parts. First, we'll be talking about behavioral health, mental illnesses in general, and what they look like in nursing homes. And then after that, we'll be talking about the Center of Excellence for Behavioral Health in Nursing Facilities. And we'll be learning about the center's history, what kind of services and resources are available from the center, how nursing facilities can access all of those, and how Ombudsmen can take advantage of those resources as well. And so with that, we will jump into learning about behavioral health. What is mental health, and why should we be talking about it? All of you that have tuned in today obviously feel like this is something that you want to talk about and want to learn more about. And mental health advocates would say that mental health care is health care. And what they mean by that is that mental health is equally important to physical health. There may be some that think that physical health is a priority and that's life or death, but mental health is equally important. And there's also a very close connection between mental health and physical health. If someone has physical health problems, it can affect their mental health. And vice versa, if someone has a mental illness, it can affect how they take care of themselves and whether they end up with physical health problems. And so let's move to the next slide and learn about mental health versus mental illness. Mental health looks like someone who's functioning well on a daily basis. They're able to be productive, have a social life, family, healthy relationships, a work life. And then mental illness, on the flip side, refers to diagnosable mental disorders. And so mental health professionals use something called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM. And in there, you'll find a whole bunch of different mental illness diagnoses. And for each of them, there will be a list of symptoms that this cluster of symptoms together indicates that this person meets the criteria for whichever mental illness they're talking about. But what you'll notice if you look in that book is that on top of all of those symptoms, many of the diagnoses also require a second criteria to be met. They say, in addition to the person experiencing these symptoms, they also have to be having a significant impact on that person's ability to function in their daily life, in their social life, their work life, their family, their relationships. It has to be impacting them significantly. And so that's a key component of mental illness, is that it's something that's not only changing the way the person thinks or how their mood is, how they feel, or their behavior, their actions that they're taking, but it's also significantly impacting their ability to function as all of us want to function in our daily lives. Next slide. Let's talk about some common mental health disorders in America. It's estimated that 1 in 5 Americans will have a mental illness at some point in their lifetime. That's a pretty big number, right? That's 20%. And if we just think about all of us together on this call today, there are likely several people on the call today who are currently experiencing a mental illness. And if not, then there are probably all of us have been affected by mental illness and have a friend, a relative, someone that we know, maybe a coworker who's had a mental illness. And so this really impacts all of us in a big way. Here are some of the common mental illnesses that you'll see in the general population. Generalized anxiety disorder. That can be very crippling if someone has severe anxiety. Right? We all have anxiety at times about things. But if someone has an anxiety disorder, that means that it's impacting their daily function. And so they might be so anxious about going outside that they don't go outside at all. And that impacts their relationships and their ability to work, for example. For major depressive disorder, for somebody who's very depressed, they may not have the motivation to do anything, to get out of bed. And so, understandable how that can impact their ability to function on a daily basis, to take care of their personal hygiene, to take care of their household, or to hold a job. Bipolar disorder, we'll talk a little bit more about that in a moment, but it's all about extremes, mood swings, and extreme mood experiences. Substance use disorders, I think, many of us have become familiar with the opioid epidemic and how that kind of addiction can be devastating, can be deadly. But there are also other kinds of substances, alcohol or other substances. And then schizophrenia, we'll talk a little bit more about in a moment. That's a serious mental illness. And then finally, neurocognitive disorders are other disorders of the brain that are common also in the United States. Next slide, please. So let's talk about nursing homes. What is the prevalence of mental illness in nursing homes? The National Institutes of Health published a study with some really eye-popping numbers. Between 65 and 90% of nursing home residents have a mental disorder. Some of those may be more common mental disorders like anxiety or depression, and then some have serious mental illnesses. That's the term that's used for illnesses like schizophrenia or bipolar disorder, where they really have a significant impact, and usually the person has to deal with that illness for most of their lifetime. It's not something that just goes away with treatment or with time. They can function, but they have to deal with it for a long time. So that's at least 3 times as much as the general population's rate of mental illness. And there are lots of reasons that may contribute to that. We'll talk a little more later about some of the triggers that happen in a nursing home setting. But also folks with mental illnesses may not have the same support system, the social support, the financial ability to manage at home that others do. And so there's some logic there to how they may end up in a nursing home more often than the general population. Next slide. Some common mental health disorders in nursing homes, they're similar to what is seen in the general population: depression, anxiety, and then, like we mentioned, bipolar and schizophrenia. Schizophrenia in particular has been reported as a diagnosis for more than 10% of nursing home residents. And some attention has been drawn to that to look at whether there's a possibility that there may be some misdiagnosis of schizophrenia in some nursing home residents for a variety of reasons. And there's been a CMS memo about that to nursing homes early this year. And so a lot of providers are looking at that right now and reevaluating residents who have a diagnosis of schizophrenia and looking to really identify whether that's the accurate diagnosis or not. So there's a possibility that that number might go down a little bit from 10%, but it's still expected that the rate of schizophrenia in nursing homes is likely higher than the rate in the general community, again, because schizophrenia is a really serious mental illness, and a lot of people with schizophrenia struggle to hold a job or struggle to maintain social relationships. And because of that, it becomes really hard for them if they have a physical illness to have the support they need to manage at home. And so they may end up in a nursing home because of that. Also, there are other situations where someone with a serious mental illness may end up in a nursing home and may really be better off in a different setting. But there may have been a variety of reasons why they didn't end up in a different setting right away, a setting that specializes in behavioral health or maybe provides housing for those with serious mental illness. And sometimes there are shortages of those services available. And sometimes there are other reasons why it can be challenging for that to be set up. But there may be situations where it makes sense for you to ask about that when you're in a nursing home. You know, is there a possibility for this person to be placed elsewhere? Next slide. Well, let's talk a little bit about the symptoms. What does these illnesses look like? Major depressive disorder. Typically, the person will appear very withdrawn, depressed, sad. They might be crying. Sometimes they're irritable. Sometimes someone with major depressive disorder might snap back at someone offering to help or trying to give them a kind word. And very often in a nursing home setting, you might see them laying in their bed in their room, even during the daytime, asking for the lights to remain off in their room and not really wanting to engage with other residents, with the staff, with any visitors. They may be not interested in any activities or even not interested in eating or meals. And so that's definitely not a good place to be, right? That doesn't feel good for the person that's sick. And it also can have serious physical health consequences. Next slide. Bipolar disorder, we mentioned this earlier. So if you look at this slide, you see one side is red and one side is blue. And so someone with bipolar disorder typically experiences extreme mood swings. They'll have periods where they're depressed, which looks kind of similar to major depressive disorder. And when you first see that, you might say, well, I think this person may have major depressive disorder. But then they have periods where they have a manic episode where they're feeling very excited, happy, delighted. They're full of energy. Maybe they're up all night pacing or brainstorming ideas. And there have been some really famous actors and other creative folks that had bipolar disorder and kind of used some of their time when they were feeling manic to come up with really great creative ideas. But having a manic episode can also be very risky and dangerous. Sometimes someone with mania will think that they can do anything. They feel limitless. And so I've seen a resident who attempted to build something in their room, and that was not a safe thing for them to be doing. They were using tools to build in the room. And then I've also had residents with bipolar disorder who asked to leave the facility and had all kinds of grand plans for where they were going and what they were doing. And those were risky plans for them. And then I also had one resident who would go on Amazon and just spend a lot of money, spend every dime that she had. And that was also, not good for her in the long run. So you can kind of see how there are considerations that have to be made when someone has this disorder, thinking about how to protect them and keep them safe. And there are medications that can help them as well with regulating their mood. Next slide. Let's talk a little bit about schizophrenia. Schizophrenia is usually described in kind of two categories. There are positive symptoms, which are maybe hallucinations, seeing something or hearing something or somebody that's not even there, or having delusions, believing things that aren't true. And then the second category is negative symptoms. So the inability to do certain things. Sometimes someone with schizophrenia can't even communicate. They can't even get a sentence out. They call it thought blocking. They're unable to speak. And if you don't understand that, then it can be very confusing when you're trying to talk to the person. Why aren't you just answering my question? Just tell me what's going on. And they may physically be unable to speak at the time. Also, folks with schizophrenia sometimes stop taking care of themselves hygienically, stop eating, and those are also risk areas for them. I had a resident that I worked closely with who had schizophrenia and had some paranoid delusions. She believed that the facility was poisoning her food and trying to kill her. And so that resulted in her not eating, which that can't happen, right? She needs to eat. She needs nutrition on a daily basis. And so, you can kind of see how schizophrenia can pose challenges to figuring out how do we support this person and how do we take care of them and keep them safe. Next slide, please. So like I mentioned earlier, there are some factors that are in a nursing home setting that can trigger mental illness, that can trigger an episode where someone is really not doing well. And some of those things are kind of obvious. If someone's in a nursing home, there's a good chance that they have a physical health problem. And it may be a new onset of a physical health problem. And so that can cause them to have chronic pain, lack of independence that they may have previously had, a lack of physical activity. For many people, a coping mechanism is taking a brisk walk or a jog. And if someone were to have a leg injury and now they can't do that, that could really impact their mental health. Also, being disconnected from family or community. We may not even be talking about actual family or friends, but maybe the mailman who knocks on the door or the clerk at the grocery store, and they're not seeing those people because they're now in a nursing home. And that can also trigger further feelings of depression or anxiety or isolation. So these are some other factors that are specific to a nursing home that could play a role in how residents experience mental illness. Next slide. Let's talk a little bit about treatment options. These are professional treatment options for mental illness: individual therapy like psychotherapy, group therapy, medications. Those can be prescribed by a doctor. We know we need to be careful about what's being prescribed. There's definitely interest in how nursing homes are prescribing antipsychotic medication, but also other psychotropic medications like anti-anxiety medication or antidepressants. But they do have a place, and they can be really helpful for residents, especially those who have serious mental illnesses. They're an important part of their recovery and their treatment. Psychosocial interventions, some of those can be done by nursing home staff that are not professionals, not mental health professionals. They can engage with the resident in different ways. Peer support, that means someone with a similar condition who maybe is doing well. That we're kind of familiar with that on the substance use side and addiction side. We've heard of like a sponsor in AA. But that also applies to mental illness, and it applies to disabilities. You may be familiar with disability peer support. And so similarly with serious mental illnesses, that can be really helpful. And finally, recovery support groups like Alcoholics Anonymous or Narcotics Anonymous. And those can be offered in or outside of a nursing home. And there are different ways that residents can participate. Next slide. Some key areas that nursing homes can look at and focus on when they're trying to ensure that they're meeting the needs of residents with mental illnesses. The first one would be creating a training program that ensures that staff at all levels of care understand mental illness. Like we're looking at today, some of these mental illnesses, as soon as you start to learn a little bit about them, you realize just having some basic information about the features of this illness could be really helpful to team members in the nursing home. It'll really help them understand what's going on for the resident and know how to plan to help them out. Second, conducting a comprehensive assessment of the resident's mental health needs, really understanding what their correct diagnosis is, what kind of needs they have, what a good day looks like for them, what a bad day, a day where they're not doing so well, looks like for them. And then hand in hand with that, providing person-centered care to address those needs. So making sure that there are appropriate personalized interventions that match the needs of that person. For example, that resident that I worked with who had schizophrenia and thought that her food was poisoned, we figured out a method of delivering the food to her on the tray in a certain way. It was covered, and to her that made her feel better and made her feel comfortable with eating the food. And so that took some trial and error for us to figure out what is it that will make her comfortable and feel okay to eat the food. And it also required extra support from our dietary and our kitchen staff for every single meal. They had to make sure to set aside her meal and set it up properly in the way that she would be able to eat the food. And so that's how a lot of these interventions look. They take some trial and error and learning, really being curious about the person. And then they also take some work. They take some specialized effort in the care. Next, allowing residents to maintain as much independence as possible. And that has to do with, you know, when I talked about that resident who wants to leave the facility and is in middle of a manic episode of bipolar disorder, what is the best plan there? Do we allow the resident to leave the facility? I know we have a lot of ombudsmen on the call today, and we think about resident rights and making sure that residents can do what they want to do, even if there is some risk involved. We all have that independence to make those decisions. And how do you balance that in the nursing home versus recognizing that someone is having a serious episode of mental illness? And so how do we balance that risk? And really important to balance it, to not go all the way in one direction or the other, which you know, each one could pose different challenges. And then finally, making sure that residents are able to access professional mental health services based on their needs. And especially in rural communities, that can be challenging. You might visit nursing homes, and when you ask them about, do you have psychotherapy or do you have a psychiatrist that's prescribing medications? The answer may be no, we're trying, but we're not really able to find somebody. Nobody's willing to come into our facility, or there's only a couple of clinicians in the community. And that's a real challenge in some communities. And telehealth has been an option that some facilities have been able to take advantage of. And there also may be community connections that you know of. You may be able to connect them with another behavioral health agency that can support them, or someone at the hospital that can support them. And so that's something to think about as well as a component of how facilities can support these residents. And with that, I'm going to pass it over to my colleague, Linda Kluge, to talk to you about our center.
Thank you, Jay. And I think I've just been kind of taking a peek at some of the questions. And I think what comes to mind, especially when you look at the percentage of people who need help, is this is a reminder that this is a great opportunity for people to understand what's available at the Center of Excellence for Behavioral Health and Nursing Facilities. This is a great opportunity for you to go back into the field and connect with your facilities and your, those that you're caring for and serving with this practical information that, Jay has kind of just laid a great foundation for us to understand that. So in the next slide, let me just say it is a honor to be with you all today and to share with you that we were so excited. And, what do you say? You pinch yourself when you received this grant, and we certainly were delighted to start this work just a little over a year ago. So we're in year 2 of this grant that is a cooperative agreement between SAMHSA and CMS. And so they what we understand is they went to visit facilities together, to the leadership of both organizations. And this was maybe around 2018. And what they learned is there's a need. There's a need out there for more work to be done to help nursing homes, especially in advance of the phase 3 regulations that were coming out. And all that was pre-pandemic. So here we are, a couple years later, and this is available to every facility, all 15,000 plus facilities in the United States. In the next slide, the purpose of the Center of Excellence is to be a model of being able to train providers, to be able to support them, to provide continuing education. And the SAMHSA has many of these. There's more than a dozen of them that are available and provide free CEUs for many, provide answers, training programs, building the capacity around different subjects. And we really have learned a lot from those who have had, standing centers of excellence for years. So we're excited to be the first one that's really been created for nursing facilities. In the next slide, it shares that this is a training hub. And so training at this time for this is in the regulations. And so certified nursing facilities are to care for residents with a wide variety of mental health needs. And so this is created for training, for one-on-one technical assistance, workforce development, and we'll talk to you about how all that's being provided. And for these lanes that we're in for serious mental illness, substance use disorders, and what happens many times is co-occurring disorders, how those come together, all laid on a foundation or a platform of the guidance that nursing facilities are expected to follow. Those tags that you know very, very well around residents' rights, around behavioral health needs, the quality of care, quality of life, they're all touched by this work in behavioral health. Next slide. We had the opportunity to design this with a regional approach. And so we looked at the CMS regions, which are the HHS regions, which are also the SAMHSA regions, and looked at how do you cover the whole nation, because really the nursing homes are across the nation that need this support. So the approach was a behavioral specialist that would be located in each one of these regions across the country. And for Alliant Health Solutions, who was awarded the grant, we cover 6 of those regions with staff that are embedded into that territory, that know those states, that can travel to facilities if needed, that can attend meetings with stakeholders in those states. And they know those states maybe in some of the community-based organizations that are being able to also work on similar initiatives. So we really felt like that was an important piece of the work. We have a strong partner with COMagine Health. Some of those of you who are out on the West Coast, you may know that group. They are a QIN/QIO, which is the Quality Improvement Organization. And so as a partner, they're really designing and really kicking off a cohort learning experience, and we'll talk about that. And they're supporting regions 7, 8, 9, and 10 out from the Midwest over. We, in addition to that, have a recovery specialist, someone whose focus is just on recovery and how that is done well, a training and education lead that lines up all the training hub offerings, a resource lead that helps to develop the newsletter as well as the materials that support the work. We have a technical expert panel that's been meeting since February. They've been engaged at reviewing our work, weighing in, providing guidance and advice to us. And then subject matter experts on many, many topics that are not just available for education, but one-on-one for technical assistance too. And there's a variety of topics that they are subject matter experts on so that we can tap them for assistance. In the next slide, let's talk a little bit about the audience. It's really everybody in the building. It's I loved when Jay was talking about the dietary staff. As a dietitian by background, consulting in nursing facilities, those are the people who interact with residents throughout the day, as well as housekeepers and environmental services. The physicians, Jay did a presentation this year to medical directors and has one prepared for next year as well. And medical directors are key with those medications that are ordered and really important players. But whether it's the social worker that meets the person on admission with the nursing personnel, everyone can avail themselves of this training hub. And we believe that all really benefit from this. It is not a mandatory requirement, as it is, for example, for CNAs are mandatory to have a certain amount of training around dementia in their education process, but it is once they're hired and in a facility that they have the training that they need to care for the residents in the building. The next slide shares that there's what we call foundational trainings. These are the ones that are offered frequently, and they're able to be tapped into, whether it's a live call-in on a webinar. They can be available online and stored on our website 24/7 to be able to tap into. Some of these, for example, de-escalation, mental health first aid, and QPR, question, persuade, and refer, our certificate programs. So those allow the person who attends those to have a certificate at the end of that training, and they are a little bit longer. The Mental Health 101, Substance Abuse 101, those are available. And, within a half an hour, that could open a dialogue for an in-service director with their team, and then for people to go back and look at it again on the website. And then trauma-informed care has been shared in a variety of ways, but we know that that's something that is in the regulations that people all need to know about in all settings. In the next slide, there's also the one-on-one technical assistance that's offered, and that is where that local regional behavioral specialist works one-on-one with the facility and completes a quick assessment with the facility to learn more about what are their needs. They're able to then customize the training that the facility wants to do, to really learn about what is their pain points, why are they asking for this information, what happened, or what do they anticipate is going to happen that they know that they want to have more information and training for their building. In the next slide, it shows that the other thing that started just in September is our cohort learning. And this is a way of bringing a group of homes together where they can learn together, share together, kind of what they say is all teach, all learn. And there's case studies, there's opportunities for subject matter experts to share, and they run in little sprints, so to speak, of 6 months. And they are done across the nation within the regional structure. So those have had many homes apply to join those, and there'll be another round of those coming up in the spring. The first round will be finishing up probably, I think, around February, but people are very excited about this opportunity to really get to know their peers and to share what's going on in their buildings as they learn together. In the next slide, it talks a little bit about the resource hub. So this is our web page, the way that the web page is set up. And through this, kind of as a portal, you can find the training materials on demand. You'll be able to figure out a little bit about ways that you can submit a request to get help, as well as the bite-sized learnings that are available. Those are just short learnings that will allow a quick huddle for people to get the education that they need around a topic, as well as fact sheets, educational flyers that people are able to use and post in their facility. In the next slide, we need to address who's eligible. So this is all designed for the CMS certified nursing facility. So, one way, if you probably the same way that you do, if you go on Nursing Home Compare, you can find out more about that nursing facility. If they are not found on Care Compare and they're not certified or they've lost their certification as a facility, then they're not eligible for the technical assistance services that we were talking about just a minute ago. But everything is available at the training hub on the website. So on there, as you go into that portal, so to speak, of that website, you can download materials. You could watch the trainings that are available there. And so that would be the way that senior living facilities, independent living, assisted living, personal care homes could avail themselves of these materials as well. So when to request help? The time to request help is when someone recognizes that there's a gap, that they may have admitted someone to the facility and they know that they need assistance. But this is really meant to be proactive, to be able to think through, what do we want to be able to offer in our facilities? What's our skills or our capabilities that we have? And when people can't meet a resident's needs and they may call their ombudsman, that's probably the time that they recognize that they need some assistance. And that's when the behavioral specialist can be on the phone with them and talk them through, okay, then let's prioritize. What do you think is the first thing that you need to do in this effort? This is not an emergency line, and it is not for non-behavioral health issues. So for example, if it's working on pressure ulcers, or if it's working on emergency preparedness, your QIN/QIO, your Quality Innovation Network, Quality Improvement Organization, may be the right people that the home needs to call. It is really for nursing home staff. So it is not so much for the residents or the care partners that are taking care of them. Those needs, though, need to bubble up to the facility staff so that they can request assistance. And then it's not for emergencies. So, whether it's calling your medical director, 911, come back though. We tell the facilities to come back when it's not an emergency, and let's put a plan together for some really great training. In the next slide, Jay, do you want to talk a little bit about ways to reach out to the Center of Excellence?
Sure. Yeah, I'd be happy to. I did post a couple links in the chat, and our website is nursinghomebehavioralhealth.org, nursinghomebehavioralhealth.org. And the way to ask for help is to click on that blue submit request button in the top right corner. And we just ask for a little bit of information. It's for the facilities to fill out. There's maybe 6 or 7 questions. They don't need to go into great detail, but they can give us a little summary of why they're reaching out. And we ask them to put their full facility name and their CCN number, which is their Medicare provider number. If they don't do that, it takes us longer to verify that they are a Medicare certified facility and that they're eligible for our services. We will still get to them, we'll still figure it out. But sometimes they put in abbreviations or a name they're known by in the community, and it can be hard for us to figure it out. When we get those requests, we respond within 2 business days. So we really try to be quick to respond. Usually it's faster because if the facility has reached the point where they've taken the time to reach out to us, we really want to make sure that we get back to them right away and that we're there to support them. And typically what happens is we'll respond, our behavioral specialist in the area will respond, and we'll ask to set up a time to get together for a consultation. So that will be like a 30-minute via video, via Zoom or Teams, and they'll talk over, find out what's going on in the facility, what kind of residents are currently in the facility, do they have specific diagnoses, what kind of issues are going on, why is the facility reaching out, how can we support them, what are the strengths in the facility, right? What do they have in place that's great, and where do they need help? And then based on that, the behavioral specialist will work with them one-on-one on figuring out how to help them out. We also have a voicemail box. So facilities that don't want to use the internet, they can call this number. We'll pick up the voicemail and we'll get back to them within 2 business days. We really recommend that facilities use the website. Sometimes on the voicemail, it's hard to catch their phone number or their email that they're leaving on the recording, and then we have trouble getting in touch with them. Next slide. So we have also some really nice materials that we send out to facilities. Every month we have a great newsletter. It has a lot of information. Because we're a relatively new center, we're still developing a lot of new resources and new trainings. And so that's the best way to find out about anything new that we've developed over the last month. It'll be shared in that newsletter. We also have articles from some of our subject matter experts. Like this past month, we had an article about SAD, a seasonal affective disorder. So kind of very timely topic. A lot of residents may be dealing with that right now. And we also shared some new resources for SAD. We have a Are You Sad flyer that can go right next to the Cover Your Cough flyer that everyone has in their elevator right now. So kind of focusing on, let's talk about behavioral health, let's be open about it. But every month we have all of that in the newsletter. We also have a regulatory corner where we share any updates that are regulatory related to behavioral health in nursing homes. We also have a self-care corner called You Matter, which shares self-care tips for the staff. And if you scan this QR code that's up here right now, I encourage you to do that. You can sign up for our newsletter with just a few clicks, and you'll start getting it on a monthly basis. Feel free to do that right now so that you remember to do it. I know we're all very busy. We also have social media. You're welcome to follow us there on LinkedIn, Twitter, Facebook. You can see some videos of some of our trainings on YouTube, so you can get a sneak peek without attending a live training. But we really recommend the live trainings because you can ask questions to the instructors. And then we even have a text messaging platform that we use because a lot of the nursing facility staff, depending on their role, they may not have a work email address, right? If the CNAs typically don't, or the housekeepers or the dietary staff. And so that's a way for them to stay connected with us. And we only send out 2 text messages a month max. It's 1 or 2 a month. But we usually share a training with them or a really nice resource that we think they'll be interested in. Next slide. Well, let's talk a little bit about how ombudsmen can utilize the COE-NF. I think that very often facilities, when they're struggling with a particular resident situation, especially, and that resident has behavioral health needs, they reach out to you. They reach out to the ombudsman and they say, help, I don't know what to do. What do you recommend in this situation? And it may be difficult to know exactly what to do. If you're not a behavioral health professional yourself, you may feel a little out of your depth sometimes. That's a great time to refer them to us. Let them know there's a great resource out there that the federal government developed recently. It's free. You can talk one-on-one with somebody and give them our website or direct them to how to ask for help. And, we find that since we're so new, a lot of facilities still don't know that we exist. I present a lot to large groups of nursing home providers, like at association meetings and those kinds of events. And there could be a few hundred people in the room representing several hundred nursing homes. And I'll ask how many of you have heard of the COE-NF, our center. And usually it's not a large amount, usually it's a small portion of the audience. So people are still learning that we're here, and you can let them know that our center is available. In general, when you're doing your visits at facilities, you can share our resources. You can share flyers about our center. We have a couple flyers that we can give you that you can print off and give out to the facility, to the social work director, to the administrator, the director of nursing. And those are just some ideas that we had to kind of, get the conversation going. But I think you all may have some other really good ideas for how you can engage with us. And we're hoping this helped you learn more about our center. And so that's the end of our presentation. I don't know if we have time for a Q&A, or we'd be happy to answer questions. I noticed a lot of really great questions coming in the Q&A section, and I wish we could answer all of them right here, but maybe we can get to a few.
Yeah, thank you so much, Linda and Jacob, for an excellent presentation and some great resources. There are some really good questions that have come in. We do have some time that we can get to some of them. I know there have been some broad questions about the center and the services that you provide, including whether there's a cost to the facilities that you're working with. And I know, Linda, you answered that in the chat, but for those who may not have seen that, could you just let folks know the answer to that question?
Yeah, absolutely. There is no charge. Sometimes they'll say, these are your taxpayer dollars at work. This is funded by SAMHSA in their cooperative agreement with CMS. As they came together, they wanted this funded. And so again, the facilities are not charged. So for example, in those certification programs, some of those are quite expensive for nursing homes to receive that behavioral health training. That is all paid for. And whether they avail it for a champion in their facility or a person, 2 people per, shift, or their leadership, or everybody in the building, it is available for them.
Thanks so much. And there were several questions from folks about how can I reach the regional representative in my area? And so just to be clear on how people should access your center, you want them to go through the center website and contact the way you have listed it on the slide. Is that correct? Or do you post a listing of your regional representatives?
But, if they're talking to a facility, we really encourage them to submit a request via our website. It's the best way to make sure that it's getting to us right away. If somebody is out of office and you're sending that request into them, we would hate for that to be sitting there for a few days waiting. If it comes through our central repository, I'll usually see it. Actually, I see almost all of them as they're coming in, and there's a couple other folks that are also monitoring regularly. And so if we see a request coming in and we know that person is not available, we'll reroute it to one of the other team members that can help out. We can share some contact information for the behavioral specialists, and if you'd like to get in touch with them for your area, if you'd like them to do a presentation in your area, maybe for your team, or something like that, we're happy to help coordinate that, and they would love to do that. They're always interested in getting to know folks in their region, and so we can share that. I'm thinking, Lori, maybe we can give you a list that can be shared with the group. That would be great.
Absolutely, we'd be happy to share the information about it. Another broad question about the use of the center, and I'm prioritizing these right now because we want people to know about the center and the work that you're doing, because that will then extend off into the other work that's more specific related to the behavioral health issues. But are the trainings in terms of accessibility, who can access them? There have been questions about whether assisted living facilities or personal care homes, for example, are eligible for these services. And I know you did have information about that on one of your slides, but if you could just quickly summarize again who's eligible for the services.
Yeah, sure. So certified nursing facilities, that means they need to be Medicare, Medicaid certified as a nursing facility or a skilled nursing facility. That's the federal terminology, but it's not an assisted living facility. It's not a independent living facility. It is a nursing home. It's what we typically think of as a nursing home that's eligible for our services. However, very important to note, our website is open to the public. Included on our website is our entire resource hub. It's open to the public. Our on-demand videos, on-demand trainings, which we've added and will continue to add, those are all available. And it's very likely that a lot of those materials, even though they were developed with nursing homes in mind, will be very applicable to other similar settings, congregate care settings, settings serving older adults that have folks with serious mental illnesses.
Mm-hmm. Absolutely. And I would also suggest to the programs that, the Ombudsman programs, to even share them with your staff, with your volunteers, with your residents and family members, because they could benefit from the recorded programming as well. There was talk there are a couple questions related to whether the trainings that you offer are required or mandatory, or are they voluntary? So again, I think you addressed this a little earlier, but if you could again just share with your share again a summary of that.
Yeah, everything's voluntary at this point in time. Although I will tell you, we've had good meetings with state survey agencies, just like we've had individual state ombudsman groups meet with us, as well as with CMS, the surveyors within a CMS region. And so as they learn about it, you know, they may say this will help a home. They may recommend it. You know, we tell facilities, put this on your 2567. When you get your survey report that says you didn't do something, say you're going to be committed to getting your staff enrolled in some formal behavioral health training and education, and that you're going to champion this well in your community. We want people to be able to receive care closest to home, and that means that nursing home has to feel competent and, as I say, confident in the way that they can care, and that they feel compassionate about caring for that person. Sometimes these may be hard people to love. Some of them have not had homes. They may have actually been living without their family supports for years. And when you bring them in a facility, we want someone to be compassionate, to know that they need to be receiving the care. They're coming into the building not for treatment alone. They're coming because they need skilled nursing care. So they may have fractured their hip. They may be in short-term rehab. There may be a variety, congestive heart failure that has required them to be in a facility. There's a variety of reasons that people need to go to a skilled nursing facility. So we want to make sure that we're meeting their needs.
Mm-hmm. And, you know, go ahead,
Yeah.
Jake. Mm-hmm.
Sorry, I would just add that, you know, our trainings are not mandatory, but training is mandatory, right? So facilities have to find a way to provide training, and behavioral health training. There's an FTAG related to training for behavioral health, and now it's dependent on the kinds of residents that are present in that facility. So they need to identify what kind of residents are there and what kind of training needs are required for the staff. And we can help them meet those requirements if they want to utilize our trainings or other trainings, but training is required.
Absolutely. And I think that's definitely one of the, also one of the messages that the Ombudsman can carry to the facilities, is that there are these resources available to help train their staff, and that you are a resource available to help train the staff in order to ensure that they have the competencies and the knowledge necessary to care for the residents that they have needs for. I want to make sure, I know we had some other resources that we wanted to touch on. So Libby, could you we have a poll, so maybe we could do that. Could you activate the poll, please? Okay, so what topic would you like to learn about next from the Center for Excellence? Because we have been talking to them about doing some additional training for you as Ombudsman. So if you could fill that out, and we'll get back with them. And I think in order to see the poll, you have to vote in it. So in order to, so we'll give that just a minute. And then we will, I just want to run through and make sure we've hit all the slides. And then if we had some time for one or two more questions, we can definitely do that. Okay. Last 10 seconds for the poll. So if you haven't voted yet, please do so. Lots of activity with people voting. They want to hear about everything that's being suggested to them. But again, it's really wonderful that the materials that you offer are recorded and posted to your website that people can download. People are asking about flyers or brochures or other information from the center. Could you let folks know if those are available and how they might access them?
Yeah, there's a really easy to use with brochure, I think. And maybe, Lori, the best thing is for us to make sure that you have that. I think it's on our website as well. But I'm thinking it's maybe a simple one pager. And then if you're visiting a facility or if you're using an iPad or even your phone, you can bring it up and show it to the nursing home when you're visiting. And it talks about training, and it talks about, our newsletter sign up. And I think that's the other thing. It's really, the newsletter is a great way to stay on top of things. And every newsletter has a section that deals with self-care for the caregiver. Here today, we're thinking a lot about caregivers with Rosalind Carter's funeral service in the Atlanta area. And we just know that this is time that caregivers can get easily burned out. You all know that. You get burned out, I'm sure, in the burdens that you carry as well. So I think it's a great way for people to be more resilient and to take care of themselves. And that's always a dedicated portion of that newsletter.
Absolutely. That's terrific. Libby, could you go to the next slide, please? We have a couple links on the next slide. And if for those who are listening, as a reminder, the slides as well are posted on the Consumer Voice website. The link was posted in the chat earlier on in the webinar, and the recording from today's program will also be available on the Consumer Voice website so that you'll be able to download it and share it. But there are some links here to some additional resources that you can access. And then next slide, Libby. We did talk about some of the tips about how ombudsmen could take this information and how advocates can take this information and use it. Certainly encourage your program representatives, both staff and volunteer, to sign up for the newsletter from the Center of Excellence and to sign up for any trainings that they may offer. And again, earlier on, Jacob had posted some links to some events that they were having. So please check back on their website and in their newsletter for events that they may be having, and encourage your representatives to attend the webinars and then talk about them at your staff meetings, at your program representative meetings, about how you can share this information with facilities and how you can incorporate this into the work that you are doing, and even sharing it with residents and families through councils and through the other work that you're doing with them. Share the resources, not only the paper resources, but also the links to the recordings that are available there. You can take them into the nursing homes with you when you go, or share the links with the nursing homes and encourage them to share them with the staff. And as Linda had mentioned, there are flyers that you can share to let them know that the center is available to provide assistance to them. So, excuse me, dealing with a cough here, just checking to see about any other questions that we may have here. And Jacob, you had said there were some interesting ones. If there were any that you particularly saw that you had wanted to answer, we can certainly, we certainly have time for maybe one or two questions here.
Well, I just wanted to share something that I think I saw a few people ask that many of you may be wondering about, and that's that ombudsmen are welcome to attend our trainings that are offered that you see on our website. We are focused on the nursing home staff, but you're welcome to attend those. If there's certification trainings where we would be using program funds specifically for your attendance, then we're unable to have you attend. So if it's a certification training, if you sign up, we'll probably get back to you and say, I'm sorry, you're not from a nursing home and our funds are restricted. But for any of our other trainings, and there are a lot of other good ones, you're welcome to sign up and join. It'll ask you when you're registering whether you're a nursing home or whether you're someone else, and you just say what you are, and that's no problem.
Thank you. And I think there, again, questions are coming up about expansion of the resources that you provide to other settings beyond nursing homes or to others. And I think we all recognize that this information is really necessary broadly, not just for nursing homes, and it's valuable and can be translatable to other settings, and can be supportive to others who need the information. The funding for this center is very specific for nursing homes, and that's why their scope of work is nursing homes. And so again, you can go to their website and look at the recordings, look at the information, and you can share those with others. But the work of the center is focused on nursing homes because that's what the funding specified. So we're not suggesting at all that the information is not needed beyond nursing homes. It's just limited scope of work. So, but we are at the top of the hour. I would like to thank Linda and Jacob again for a really terrific presentation. You can tell by the responses that people are very excited about the work that you're doing and about the center. We do look forward to continuing to work with you and to have you back again to share more information, resources, and training. Again, we'll be sending out links to the recording and the slides after the webinar. You can get them on the Consumer Voices website and on the Ombudsman Resource Center website. And thank you all so much for being with us today, and we'll look forward to talking to you again soon.
Thank you, Lori.
Thank you. Take care.
Bye now.